This is Martin Giles of the Guildford Dragon News, and I'm with Louise Stead, who's the Chief Executive at the Royal Surrey County Hospital, responsible for the running of the hospital in what is perhaps its most challenging period. Welcome once again to the Guildford Dragon, Louise, and thank you as always for giving your time from, I know it must be always a busy schedule, but particularly so at the moment. So thank you very much for joining us.
My pleasure. It's always nice to have a conversation.
Good. Okay, so the pandemic is unfortunately still clearly with us, and now with the emergence of the Omicron variant presents a new threat. How is the Royal Surrey coping with the current levels of demand? Not all from COVID, of course, and how are you preparing for the higher intensity winter months?
So, I mean, demand on our services is definitely increasing, but I think this is happening at NHS trusts across the scale. So it's not just the Royal Surrey. COVID cases are rising locally, but as your listeners will know, we built a 20-bedded infection control ward earlier in the year. So we are still using that for our patients. So the COVID patients we have at the moment are within those, either there or within our intensive care unit. And we're managing well, really, I think. We continue to have stringent infection control measures. And we're constantly assessing what we're doing to make sure that people are being kept safe. I think maintaining our bed capacity and patient flow is absolutely key. And we are, meeting several times a day to make sure that we are managing that the best way we can. I mean, I think that what is really, really important is that people do turn up, I suppose, to appointments. They turn up for their operations. As I say, our infection control processes are as stringent as they can be. We are continuing to limit the visitors we have within the trust. And I know that is disappointing for some local residents, but we have to try and keep all the patients we've got in there safe. So we are having one visitor in a bay at a time, and we are trying to limit the amount of time that people come in. Obviously, we're making adaptations for patients who are at the end of life, and also patients for relatives who have caring responsibilities. But I would really ask people to support that, because it isn't that we're trying to be awkward.
Okay, okay, I understand. And you just froze for a second there. My hesitancy is with that. Don't worry. But the end of life visits are obviously sensitive, and so at the moment they are allowed, but there are limitations. Is that correct?
Yes, we've always continued to allow visits at end of life, and also if people have a caring, if they're coming in to sort of feed their relatives or something like that. But we are trying to minimise. As the variant, as the numbers increase in the local community, we need to make sure that our hospital stays as safe as it possibly can be.
Okay, and what spare capacity do you still have? Are you full to the gunnels, or you still have some spare capacity to play with?
I mean, I think we are pretty full, to be perfectly honest with you, Martin. We are still continuing to do some recovery, some surgical recovery. So it isn't that we've stopped doing surgery as we did in the first wave. That still continues. So I think we have capacity to keep patients moving through the hospital. And at the moment, our infection control ward is not full of COVID patients.
Okay, and that's the Guildford ward, is that the one?
It is, that's
okay.
Right, yes.
Okay, now, given the current high rates of infection in Surrey, and it does seem quite high in Surrey compared with other parts of the country, what is your biggest concern about that? Because from the stats I do every week, there's obviously a lag time, but they're still not coming through as very high rates of admission on COVID patients, nor, thankfully, on the death rate. So, and the other thing that's noticeable is that the admissions at the Royal Surrey are lower in proportion to your bed spaces than other Surrey hospitals. Sorry, there's several questions there, but perhaps you can explain.
Yeah, well, that's an anomaly for me too. So if you looked in the previous waves, we had less patients in the Royal Surrey than our local trusts, even looking at that on a bed proportion basis. All I can say is, maybe the residents of Guildford are listening to the messages. Maybe they are wearing masks, maybe they are following social distancing, washing their hands. All of that is really, really important. I mean, I think you're right, the rates are climbing. We have seen a small increase in numbers, but not, a massive increase. I honestly can't explain it either, to be perfectly honest with you. And I know when we looked at the modelling, the modelling for this wave said that because we had fewer numbers last time, we would end up with more numbers this time. Well, that's a slightly bizarre modelling, and that didn't come true with the second wave. So I'm just hoping that the people of Guildford are listening to the public health messaging. I mean, that is the only reason I can think of.
Okay, but you would think that would also affect the infection rate, which it doesn't seem to be doing.
No.
So it's a bit of a puzzle, really.
It is a puzzle. I mean, I think we've got good vaccination rates locally.
Yes.
I think we're getting good uptake for boosters. Yes. I think what is interesting with all of this is that we do need, vaccination and boosters are part of it. But as we move into the Christmas period, it is, all about how we make sure that we continue to ventilate our houses, we have social distancing, we wear a mask when it's appropriate, and all of those things will help protect us. Yes,
and I guess particularly until we understand more about the Omicron variant.
Yeah.
Okay.
Absolutely.
Now I've forestalled my next question, so I'll go straight to this. No, and that one actually. The pandemic's been going on for 2 years now. How badly is any COVID fatigue affecting staff morale?
We definitely have staff that have been affected by the pressures. I think that it would be, it would be impossible to say anything other than that. I think we are trying lots and lots of ways to support people. I think that, people who work in healthcare, whatever you do within a healthcare environment, they tend to try and feel that they can cope. And I think what we've really tried to get across is it's okay to say you're not okay. So we've invested in some mental health teams, we've invested in some psychologists, we've built a wellbeing cabin at the back of the trust, which is really sort of having health and wellbeing workshops for staff. It's doing some sort of yoga and things like that. I think it is important that people are able to talk about what they've experienced in the last 18 months. Next week, we've got a week-long thank you for all our staff, which we're calling Winterfest. And we're sort of having some activities, some drinks, obviously not alcoholic, some music, a few sort of surprises, and we're giving out some sort of badges to recognise everything that people have done over the last 18 months. And local businesses and retailers and our Royal Surrey charity have supported that. So that's really good news. We've also just this week, we've launched our family support service at our Fountain Centre, which is for children of patients who've been recently diagnosed with cancer. We realised that actually for those patients, it's been a really difficult 18 months. And we were delighted to have Flavia from Strictly opening that this week. So we're trying to look at supporting our own staff, but supporting the relatives of our patients as well, because all of those groups have been adversely affected in the last 18 months.
Yes. So what is you've said, you've given some advice already in the interview about for people to keep their vaccinations up to date. And by the way, what's going to happen to the NHS people who have been reluctant to get vaccinations, but now I think it's mandatory for them? How are you finding that? Are they accepting that they've just got to have it?
Well, to be honest with you, the guidance came out very late on Monday night. So we're still working through the guidance at the moment. I mean, I think that, we will be speaking to people who are reluctant to have the vaccine. We will be offering them support. It is an act of parliament. It's sort of out of our hands what happens. Yeah. But I think the majority will definitely, understand that in order to work in a healthcare environment, you need to protect patients. But we haven't quite bottomed that out yet. As I say, it came out I think about 7 o'clock on Monday night.
Okay, fair enough. So what about other advice then to, apart from the COVID pandemic advice, what about other advice for people who have health concerns, but maybe finding it difficult to get a GP's appointment, or they don't know, they've got a niggling doubt, but they don't know whether they should trouble you with it because they realise that you're under pressure? What's your advice to them?
So I think that, you know, all our healthcare services are open. You know, GPs are seeing an enormous amount of referrals. I think that, you know, that they're back to doing face-to-face work. Obviously, they're supporting the booster program. But I think, you know, if you've got a concern, absolutely contact your GP, you know, absolutely contact 111. I think that, you know, if you're offered a flu jab, if you're offered a booster, please take it up. We know that all of these things really, really help. And, you know, if you've got something that you think is life-threatening, you obviously, you know, or you've had an accident, you obviously come to our emergency department. But for anybody who's feeling unwell, their first port of call really should be their GP or their pharmacist or NHS 111, because we do want to make sure we get we use the scarce resources we have as appropriately as we can.
Yes. Okay. Well, thank you very much once again for your forthright answers, Louise. And I will repeat without apology my thanks to you, and reflecting, I'm sure, the thanks of lots of Dragon readers, because, you know, we do all rely on our NHS and for literally life-saving treatment. So I'm sure they would want to wish their best wishes, especially at this time of year.
Thank you, Martin. And obviously we rely on the support of the local community. So, you know, it's a two-way street.
Okay.
Thank you.
That's great. Thanks very much. Bye-bye.
Bye.